one of the most important things in counseling is choosing assessments which are correct for our clients and are going to be beneficial and therapeutic for them. Today we're going to look at a case study on an application of an assessment, so we can dig deeper to see how to choose them while we look at the case study. Eddie and his mom have come in, and Eddie is an 8-year-old third grade student at the local elementary school. His mother's bringing him in due to problems Eddie's experiencing at school. Eddie's mom comes in desiring some help figuring out why he continues to get in trouble and why he won't comply with simple requests, both at school and at home. According to his mom, teachers are reporting that Eddie is getting agitated quickly in class and has had multiple school disciplinary actions due to non-compliance or insubordination. While not entirely disrespectful, Eddie will shut down or refuse to comply with directives when asked to take off his hat. Eddie states that he needs his hat to feel comfortable. Eddie's parents really don't know what to do at this point. He does engage in other things. He goes to Boy Scouts and the YMCA, but he doesn't show an interest in having close friends to play with. Eddie does prefer to have things a certain way at home and sticking to certain routines. ABC data shows that his behaviors are increasing and or he's becoming more acutely distressed, and they just don't know how to move forward, so they need help. Based on this information, we automatically think an autism spectrum disorder is at bay. Basically, this is a neurodevelopmental disorder characterized by deficits in social communication and social interaction, as well as restricted or repetitive patterns of behavior. Symptoms must be present in early developmental period, but may not appear until social demands exceed capabilities. There is significant impairment in social, occupational, or other areas of functioning. These must not be the result of an intellectual disability or other developmental delay, and there are severity levels for autism spectrum disorder from 1 to 3, with level 3 needing the most support. After reviewing many different assessment screening tools and diagnostic tools, I chose to do the autism behavior checklist. The authors were Krug, Eric, and Almond. Original publication date in 1978, and then redone again in 2008. The ABC is a subtest of the Autism Screening Instrument for Educational Planning. It consists of a list of atypical behaviors characteristic of those having an autism spectrum disorder, and it's designed for the screening of children suspected of having an autism spectrum disorder. It is used to help professionals screen for ASD in children to make appropriate referrals based on outcomes. The appropriate grade level or age is from 2 years to 14 years. Of the 57 items on the ABC, each item is scored from 1 to 4, and the total score is obtained by adding the weight of the different areas. Scoring for each item is weighted based off of the significance to the diagnosis of autism. Subscales are scored and then totaled. The identified cutoff point for classifying children as suspected of having an ASD is 68 overall. Scores between 54 and 67 indicate a moderate probability of autism. What set this one apart from the others is that it's divided into 5 categories: sensory, social relating, body and object use, language and communication, and social and adaptive skills. The administration time is only 10 to 20 minutes for each administration, and the test is only $30 and $75 for the administrator's manual, which is relatively. The identified cutoff point for classifying children as having a suspected ASD is 68. Scores between 54 and 67 indicate a moderate probability of autism. Concerning validity, the criterion of 68 was 57.89% and was much higher when a lower 49-point cutoff was used with 92% validity. Concurrent validity was high at 81.6%. Reliability of the test is an indicator of the quality of the information is understood as the agreement between the information provided by the observers or a single observer performing distinct measurements. In terms of this test, the internal consistency reliability was a 0.73, and the test retest was a 0.83, indicating results were stable over time and interpretations can be trusted. Because the nature of the presenting client exhibited quality similar to those someone diagnosed with autism spectrum disorder, I chose the ABC. The ABC is a screening tool for potential ASD, not a diagnostic tool. Because I'm not formally trained or specializing in autism spectrum disorders, I do not feel I should administer any formal diagnostic tools requiring specialized knowledge. By administering the ABC, I'm still acting in the helping profession by ruling out causes of the presenting behaviors. Another reason I chose it is because the ABC assesses multiple areas in different subscales. Other screening tools may ask similar questions or have rankings for similar statements, but the ABC has sectioned the questions into 5 subscales: sensory behavior, social relating, body and object use, language and communication skills, and social and adaptive skills. These subscales provide a more precise information regarding the client's behaviors and how they relate to any autism spectrum disorder. Because behaviors were happening at school and a little at home, it was important for me to identify a screening tool that would be able to be completed by both the parent and the teacher. When reviewing other screening tools for ASD, very few were approved for teacher completion. Most of the client's behaviors were being exhibited in the school setting. Therefore, it was important to compare both the teacher and the parent and teacher rating to account for observations across settings. Unfortunately, there are no medical tests that can be used for diagnosis of an autism spectrum disorder, but professionals or other specialists can use more in-depth diagnostic tools. Overall, the Autism Behavior Checklist is an adequate tool for screening for ASD because it's simple use, scoring, and low cost. There are many more screening and diagnostic tools available, but the pros for administering the ABC outweigh other choices. The reliability and validity are not as high for correctly identifying those having an ASD, and it's suggested a lower overall score might be considered as the cutoff point, but the subscales provide good information which can help direct counseling services and referrals to the appropriate specialists, where other tools do not break down the analysis quite as far.